Can you overpump with EVEBRA?
Frequently asked question, is there anything we could do to accelerate the process?
Why is BRAVA not available anymore? Have you noticed any cohorts of people who are good candidates versus not? If women have tuberous breasts, can they use EVEBRA? Will it fix or help? Hi, we're here with the inventor of BRAVA and EVEBRA, Dr. Roger Khouri, and I'm Chie. We're gonna answer some of the questions that you guys asked on Reddit AMA. All right, Dr. Khouri, are you ready for this?
Sure.
First question, how does EVEBRA actually work? What's the science? How does it enlarge your breasts naturally?
So BRAVA, EVEBRA is based on the principle that if you stretch tissue, live tissue, healthy tissue, gently over time, it will grow. This is a universal property of living tissue that will respond to stretch by growing. If you think about it, the tissue are always under some tension, and then if something disrupts the tension, they grow to restore that normal tension. That's how we grow as children. Our bones have growth plates. That's how we grow. It's a very natural phenomenon. A lot of medical devices are called tissue expander. They're based on the principle of stretching tissue to make it grow. We can take short people, make them long by stretching their bone and extremity lengthen. So it's a very well established principle in biology called tension-induced tissue growth.
From a medical perspective, it makes a lot of sense. But for someone who's not in the medical industry and wants to have a more of a simple understanding, there's a lot of questions along like, how does it actually work in a simpler term?
All right, so you ask a lot of questions there. Let's go back to the basics. So tension-induced tissue growth. You stretch tissue, it senses the stretch, it grows to restore normal tension, their normal resting tension. Now, if you put the breast tissue under tension, which what vacuum would apply uniform tension all over, it's going to stretch. It's got a normal amount of elasticity, and some vary from others. They've deflated after pregnancy, they'll stretch easier, etc. But that's going to stretch, but you haven't grown tissue yet. It's just simple stretch, and that looseness is going to fill by our own filler edema. So initially when you put BRAVA on or EVE on, you're going to gently stretch it and create edema. You haven't created any tissue. Now, if you maintain edema over a long period of time, it will turn into fat. The body would sense this deficiency, this void. Our natural filler is fat and will replace it with fat. You probably heard of ladies who had mastectomies and their arms swell because of lymphedema. And they have to milk it to make sure it doesn't stay, because if that edema stays, that turns into fat that we actually liposuction to get rid of. So you put this device on and you stretch and you get some edema. With time, you go beyond the viscoelastic natural stretchability. Tissue can grow more, the edema enlarges, the amount of edema stays, and with time, that edema replaced with fat, and with time, that stretch increases and increases. So as you wear the device, you're going to always have some edema and then a small amount of real tissue growth happening behind it. If you stop it, the edema goes away and you're left with the real tissue growth, which after a few weeks, a few months, is really not that much. It's only after a certain period of time that the real tissue growth adds up.
And is this fat tissue or breast tissue?
Very good question. No, we don't grow more breast tissue. We typically end up with more fatty tissue.
And so will it fluctuate? If you lose weight, you gain weight?
Just like a normal breast, just like normal breasts do. Women will tell you that if they gain weight, the breast gets a little larger. They lose weight, it gets a little smaller. So yes, it's normal tissue. As compared to the silicones, never going to change. It's going to still be there.
And what is the minimum time you need to be wearing this per day?
All right, so here's the issue there. You put it on and you invite edema and it stretches. After a few hours, that's it, you get a good amount of edema, you stretch it. Then you take it off. The edema goes away. You put it on again, then the first few hours are going to be lost getting to where you were before you took it off again. So it's a step forward, step backward, step forward, step backward. To really add upon, you really have to wear it consistently beyond the deflation period, ideally at least 12 hours a day. 10 is a compromise, but really 12, so that you have it on more than you have it off. So that you really, when you take it off, when you put it on again, there's still some memory of the previous time. So you add instead of back and forth, staying in place.
So when you say that the breast fluctuates, the swelling fluctuates, does that mean that you shouldn't be in a caloric deficit?
Well, these are two separate issues. The breast fluctuation with the edema, volume fluctuation with wear and not wear is separate from the really fat buildup. So yes, as you build up edema, as you maintain the edema over a period of time, gradually the body is going to want to replace that edema with fat. If you are in a fat building stage, it will happen faster. If you are in a fat losing stage, like you're losing weight, the body's not going to put fat when you're losing weight somewhere else. So ideally, you should be at least, if not neutral, a little bit of a fat building phase, and then your body will preferentially put the fat here because there's a need here to put the fat.
So what does that mean? Should they be eating more fatty foods?
Well, it's more a matter of calories. It's more a matter of calorie more than fatty food. Now, fatty food contains more calorie per gram than sugary foods, but you should eat more calories. Basically, I don't want you to try to lose weight while you're putting it on. One thing you could do, however, is if you put it on, if you want to lose weight, putting it on will make you lose less weight here than somewhere else, maybe.
But does it matter what type of food you're eating, or is it purely just calories?
It's essentially calories. Okay, what really matters more than anything else is calories.
How does EVEBRA differ from BRAVA or the other suction devices that are more affordable?
That's a very good question. So, we introduced BRAVA more than 20 years ago, 25 years ago actually, and it was based on the seal on the body requires an adhesive layer. So it was stuck to you. There was a cushion of silicone, literally a cushion of silicone, a ring cushion of silicone, and that was stuck to you. That caused a lot of problems because having something stuck to you creates friction problem, creates shear force issues. And some people don't like this, you could be allergic to the adhesives. The new Eve is actually totally opposite. We require gliding. Instead of an adhesive, we have a lubricant. We want it to glide on the body, so it achieves its seal by wrapping around the body with a silicone that's a little bit like a scuba diving mask that's wrapped around the body. Of course, fancier than scuba diving mask, but that's the same principle. Now, the novelty devices that you can buy cheaply on the market have no science behind them. Eve has a tremendous amount of engineering behind it, tremendous amount of science behind it. It is manufactured at the medical grade level by companies that manufacture medical devices. The components are all medical grade. So it's a totally different level. It's got science behind it. It's got electronics that maintain a pressure within a well-defined, healthy range. And all these other pump devices have none of that. So you couldn't keep them. You couldn't keep any of those devices on you with the pump on for more than a few minutes or a few hours because they haven't studied the counter force, the shear force, and the balancing of the forces, the pressures, the safety, and the efficacy. BRAVA, Eve have scientific studies that prove that you can grow with time. Scientifically proven by medical studies published in the most respected medical journals. The others are just gimmicks.
That makes sense. especially the part about medical grade materials. That makes sense why it would be significantly also more expensive than the affordable items you can buy on Amazon.
Right.
There's also a lot of questions regarding the safety, the risks, and a lot of concerns. People asked, is it safe to apply suction for hours every day?
So that's actually a very, very good question. And that's our fear when we started this. Oh my God, we're going to grow breast. Growing something in the breast is not necessarily good. So we did a lot of science early on. First of all, there is no evidence at all that mechanical forces, suction, are carcinogens. Okay? Whereas hormones and all those supplements that contain hormone-like effect are known carcinogens. So that right there differentiates it. But then the most important thing here is that we followed early on the early experience of BRAVA, we followed a cohort of women who wore BRAVA. And we matched it with a cohort of women, healthy women, obviously, who did not wear BRAVA. And then we looked at their breast cancer incidence, and we found it significantly less. We actually published this, and we thought, oh my God, this actually should be probably cancer protective. There may be an idea behind it because the pumping in and out gets rid of the toxins. One of the reasons we believe breast cancer is a problem is in the breast because toxins remain in the ducts and in the breast, and it's accumulation of toxins over the year that's probably carcinogen. Whereas that milking effect of putting it on, sucking it up and down, just like breastfeeding is protective for that same reason. It empties those ducts that can be filled. So there may be some science behind it, but bottom line is, if anything, it's not. And this was corroborated by one of the leading breast cancer experts at the time, Dr. Susan Love, who said, when we asked her about it, she said, I think of all the things women could do to their breasts to enlarge their breasts, this is probably the safest.
Are there risks of blood clots, skin damage? We already talked about cancer. So blood clots or skin damage?
Well, skin damage, yes. If you put a device that's not properly engineered to maintain a counter force and the shear forces and all the things, you can have skin damage. Okay, so this is why EVEBRA has a low machine that maintains the proper safe level of pressure. A hand bulb is not controlled. You could get a very high pressure that will destroy tissues. So yes, it's very important to have the proper pressure. In our experience, since we stopped using the adhesives and we resorted to a gliding surface of a gel that is a lubricant gel and a machine that maintains a low pressure, we've seen no complication in thousands and thousands of women. There's minimal skin irritation and certainly no clots, no problem like that. But if you go to higher pressure, you could get the blood pressure to explode in there. Yeah, pump it too high, would you think, and you can cut damage. That's not what EVEBRA would do. We don't have a pump. We have a mechanical device that maintains very well engineered pressures.
I have seen a lot of comments on the Reddit account of people using other pumps and kind of combining EVEBRA with other methods to speed fast the process.
We don't recommend it, and that's not how it should be used. And if they're doing it on their own at their own risks. We don't recommend it. We have protocols sometimes for medical indication, and in Europe they're using it, or it's approved with a special pump. But it has to be well controlled with good electronics, where the high pressure is only limited amount of high pressure and limited time of high pressure. You just can't play with it like that. You have to have some science and some clinical studies behind it, which we have plenty of.
That makes a lot of sense. Okay. Are there any signs of overpumping? If it gets purple or they start feeling pain?
We don't recommend using a hand bulb because you could overpump there. If you just use the machine that gives you the 20 millimeters, you're not going to have problems. Okay. And the most important thing here, it should never be painful. pain is our fire alarm. You know, we have pain when something's wrong is going on in our body, and we need to address it. If you have pain, there's something going on, stop using it. It should not be painful. Maybe uncomfortable, maybe bulky or whatever, but no pain.
And a lot of people ask this one actually, can it cause sagging or loose skin?
Very interesting. We thought, oh, maybe it will cause stretch mark. We never found new stretch mark caused by it. So you don't have that. And as a matter of fact, a lot of the women who have sagging breasts, when they use it, it inflates their breast. It does the opposite. A sagging breast is a deflated balloon, and you inflate it and lift it back up. So yes, we have the opposite effect. We actually see them filling them up.
That's great. Oh, this is also a very common question. Some women want extra even though they've had implants, and they want to use it combined, having their implants and EVEBRA. Why should they not use EVEBRA with their implants?
I have shunned away from recommending that for a number of reasons. One of the reasons is, as you apply the tension, instead of the tissue growing, you may invite fluid in the space between the implant and the capsule. So that may actually invite fluid. And that's the bad thing. Second.
Sorry, because we're creating fluid.
No, but now we're talking difference from fluid as edema in the tissue versus fluid in a well-defined space, nothing in between. There's an implant and the capsule of the tissue, and now you have space that's filled with fluid. Edema is different. Edema is not a space. Edema is a compressed sponge that opens up. You still have all trabeculation, there's tissue in between. There's no real void. It's just you loosen up the tissues, but you don't have a cavity. If you have an implant and a capsule, you can separate them, and now you have a cavity, and that can fill with fluid. So that's one of the problems. The other problem is many implants have a footprint wider than the aperture of the EVEBRA, and so it'd be sitting on basically implant tissue, skin that's very fat. The circulation to a breast that has an implant is only coming from that periphery, right? And if that periphery is occluded by the implant, you're having problems. You don't have the blood supply going directly to it. You understand? There's an implant in between, so there's no blood supply. I would not recommend it.
It all sounds very painful.
I would recommend it.
If women have tuberous breasts, can they use EVEBRA? Will it fix or help with this?
Okay, so tuberous breast is a spectrum of deformities, from breasts that we call constricted, just hanging over for a shelf because the lower pole did not fall, to breasts that are tubular, like a tube, just a nipple that sticks out. So there's a spectrum of deformity. The basic problem with tuberous breast is that there's a fascia, there's a layer of tissue that has prevented the normal breast from growing. A breast is a sweat gland, a modified sweat gland, and at puberty in women, it will grow into a breast. If there's a strong layer of fascia, a membrane, if you want, that prevents that, it will grow over it, or it will only grow through a small hole. So there's really something inherently abnormal in the chest wall of that woman that prevents the growth. You put Eve on top of it, and it's going to pull the path of least resistance. It's not going to pull over this membrane. It's going to actually accentuate the deformity.
Okay, so now let's talk a little bit about the techniques and some usage tips. When we're talking about the technique, how and where you place the pump, does that add to the growth? So
the women who have the least amount of tuberous deformity on the spectrum, there's just some lower part that's not growing. I ask them to wear it lower. That may stretch it, that may improve it a little bit. Overall, otherwise, just put it in the middle. No big deal, okay? Just whatever it sits, no big deal.
For people who can only use it, let's say 1 hour a day, Is it still worth it?
1 hour a day is just going to give you some fullness, barely. You're barely going to invite some stretch. And then 23 hours of that day, you're not going to feel a stretch. So you really don't induce the stimulus for tissue to grow. 1 hour a day is going to do nothing. 1 hour a day for 10 years is not going to do anything. Okay, don't lose your time.
Okay.
Don't lose your time. You gotta put it for a few hours at least for it to grow. You have to maintain the edema. The idea here is to maintain a chronic state of edema that the body feels that you're really stretching it all the time. If the stretch is gone more than it's on, the body's going to say, that's fine, it's just normal stretch. The body only responds to the stretch if it's on most of the time. You got to do something about it. If it's on and off, we are constantly on and off stretches.
Is this safe to wear while you're sleeping? A lot of women ask, can I wear this while I sleep at night?
We actually recommend try to wear it at night. This actually, most women can't wear it during the day because they want to go out and they don't want to go out wearing it. If they're fortunate to work at home, they can wear it at home, which is great. But no, we recommend to wear it during the night. Now, it may be bulky. And when I tell women, get yourself one of those maternity pillows, big pillow, one or two of those, wrap them around you, and that helps cushion it, make it more possible to move around with something around you. But yes, you have to learn to sleep with it at night. It should not be painful. You get used to it, and after a while, it may take a few days to get used to sleeping with it, but after a while, most women feel very comfortable sleeping with it at night.
The expectations, like the real importance of it, because it's not going to happen overnight, right? This is not like you pump it in, then it's done. This is your own tissue that is growing. Similar to when people get braces or they're using the retainers to change their teeth, it takes months, maybe sometimes even years to get that, and yet it's a small change, right? So with the expectations, what can people expect? What body types respond best?
You touch on a very important subject, and you made a very good comparison. We can't expect to grow healthy tissue overnight, or even a week or two or a month. When you think about it, the fastest growing thing we have in the body is an embryo, and it takes such a long time to grow, and it's doubling time. So when it's tiny, it's doubling time. In biology, the measure is doubling time, how much time it takes for something to double in size, all right? So we're creating real tissue. And so if you're small, you're gonna double and double and double. If you're large, you're gonna double and double. But the gain of volume from 100 cc's doubling, okay, versus a 400 cc doubling is tremendous. So, having said that, the women who have deflated their breast after pregnancy or weight loss are going to see very rapid reinflation. It's very rewarding to see that reinflate relatively rapidly in a matter of a few weeks of where they're going to reinflate them. But that's not real tissue growth. Now they've got the edema in there. Now they have to persevere and keep it on for a few more months until that is transforming to fat. So the best candidate is the lady, the one who will see the most result, the fastest and the most impressive, is a lady who has lost her breast volume from either breastfeeding or weight loss, has reinflated it and wore it for a few months, and already had some breast volume when she was breastfeeding or when she had her weight. These will get the best result. Now, unfortunately, the one who really wanted the most are the young lady who are pretty flat-chested. And these are the ones that really need help, because even if you were to put an implant, it will always look fake under a flat-chested girl. An implant under somebody plenty of fat, you hide it, it's hidden, it's not a big deal. But somebody flat-chested really would like to see her breast grow. And these are, unfortunately, the girls who would struggle the most. But they'll be rewarded. If they persevere, they'll get there. All right, so if you only start with 100 cc's, it's going to take a long time to gain another 100 cc, which is even smaller than smallest implants. But now you're 200 cc's, right? Now we're talking, because now you're going to double that 200 cc. But it may take many, many months. So I tell these women, try to get into a routine, learn that it's going to take a few, probably a year or two. When you think about it, the Lord did not give women breast overnight. Puberty, breast growth during puberty takes years. And we're not going to beat nature. Anybody who tries to beat nature is fake. Okay, you put an implant, it's fake. Anybody who tells you, my breast grew immediately. BS. Nothing real is going to grow immediately. You may have edema, you may have some swelling, nothing grows immediately. Okay, it takes years for a breast to grow, and if you're from flat to a solid B cup, in the healthiest of the young teenage girls, takes years. So it's going to take a few months. So you're going to learn to persevere. Oh, I see no growth. I get a lot of women who come back and complaining, I see no growth. Well, the problem here is they don't remember what they started with because they were used to that edema. And when they come back, well, there's still some growth. If they were more than a few months, there's going to be some growth for sure. But unimpressive compared to the edema they're used to. And they forget what they looked like 3 months ago.
But so how many months realistically?
Okay, so our studies have shown that it takes at least 4 to 6 months of intensive growth to gain about 50%. Okay, so and intensive means more often than not. Okay, that means you got to wear it more than 12 hours a day. If you do that on a regular basis for 6 months, you will grow by doubling your breast size. Now, if you are an A cup with barely 100 cc or 50 cc's of breast, it may not be very impressive. But if you already have a nice B cup or a deflated B cup, you're going to see that. You're going to see that. And our experience has shown that you really get tremendous growth.
So you mentioned deflated breasts after breastfeeding has faster results?
Well, faster edema formation.
Faster edema formation.
Yes. And lift. It will reinflate the breast. During pregnancy, with or without breastfeeding maintains that swelling a little longer, but women who had their breasts stretched from pregnancy and or breastfeeding or weight loss that has the tissues already, the memory of the tissue is already there, they will reinflate with edema very rapidly. That doesn't mean permanent growth. It's edema. But that will give them great looks, and as long as they're wearing the Eve, they're going to be good, they're going to look good. But for real tissue growth to happen, it's going to take many months. That is, if they only wore it for a month or two, when they stop wearing it, the amount of growth is not going to be very impressive. But if they can persevere and reach the 6 month point, they're going to have significant growth.
Some people also asked if you can wear this for a year.
Oh yeah.
2 years.
Well, yeah, it's just a matter. The longer there's no limit to the growth that can be achieved. It takes time, but if you stretch tissue, it's going to continue to grow. And as surgeons, we've been able to really lengthen extremities significantly by stretching the tissue, expand tissue significantly. It's just a matter of you got to keep on doing it.
Okay, and so realistically, an A cup person, can they get to a D cup using EVEBRA?
Oh. So let's do some math. Okay, an A cup person has barely 50 cc's of breast volume. Okay, so the first 6 months she'll get to 100. The next 6 months she'll get to 200. That's a year. The next 6 months she'll get to maybe 300-400. That's a year and a half. The next 6 months she'll get to 400 or 500. So it will take her a couple of years at least to get to a small D cup. So she has to wear it every day, 12 hours a day, for about at least 2 years, which is really the time it takes for a breast to grow during puberty. We're not outpace nature. We're not going to outpace nature. That's what the Lord gave us. It takes 2 years at least for the breast, and most of the time it takes more than 2 years to grow. That's the rate at which real tissue grow. We're just basically growing tissue the natural way. There's no gimmick here.
Different body types can react differently, right? Some people could grow it faster, some people grow it slower.
Sure. So everybody heals differently, everybody responds differently. There's a significant variation. We look at the average, but yeah, I mean, some people will achieve the doubling in 4 months. Some people will require 8 months. The average is 6 months. You know, there's variation among humans.
That makes sense. So we also get a lot of questions. What is the maximum, what is the largest size we can get to with EVEBRA?
All right. Let me first back the question is, the question most people like to ask me is, how many cup size can I increase? Or what's a cup size? Think about cup size does not correlate with volume. There is a difference in volume between an A and a B. It's not the same between a B and a C and a C and a D. It's not every 100 cc is 1 cup size.
Right.
Okay. And cup sizes also vary with the chest circumference. That is, a girl who's got a 30 chest circumference requires much less volume to get to a D than a girl who's already at 34 or 36 cup size to get to a D. The girl who's 36 needs liters to get to a D as compared to so cup sizes don't correlate with actual volume. Having said that, EVEBRA comes with a series of cups, and that's really the big advantage compared to the old BRAVA. It comes with cups from size 1 to 4 in the kit, and you could, if you outgrew the 4, ask for a 5, a 6, a 7, and even an 8. So the 8 is a huge torpedo like this, okay? I mean, rarely, we've seen very few of them, because if you're already that big, why do you want to be bigger? It's already big, all right? But having said that, once your breast filled up the size 3, you move to the size 4. Now that is all edema at your size 4 still. When you stop using it, you're probably going to get back to the volume for 2, size 2. And that's one way you can figure out how things advance. Your question is, how many cup size can women increase? We just said it. It's a doubling every 6 months on the average. So if you go, if you start with 100 cc breast, which is a cup, and you want to get to a B, which is at least a 300 cc breast, it's going to take you a little over 6 months. Okay, but if you're already a B and you want to go to a C, it will take you probably more than that. It's a variable thing. There's no real absolute numbers. People vary. There's a variation among individuals, and a B person will respond differently than a C person, and a B person with the largest chest will respond differently. This is human variation.
Maybe we can explain it in terms of correlation with the cup sizes to the bra cup sizes. So like a size 1 is an A. Size 2 is like a bigger A. Small B.
Size 2 is probably a big A, that's right.
Big A.
Yeah.
Size 3, now you're entering the B cup.
Correct.
And then size 4, you're in like the C.
You're a big B, small C, correct?
Big B, small C.
Yes.
And so you want it to keep growing, you want to get to a D. Now you're going into size 5.
Correct.
That's like a D.
Size 5, you're a solid C, yes.
You're a solid C. Size 6, now you're a D.
Correct.
And then size 7.
Maybe 7 for a D, yes. Maybe 7 for, but this is edema sizes. If you stop wearing it, you're gonna lose the edema component, and you're gonna be left with the real tissue growth component, which has depended of how long you've worn it. See, the deflated breast after breastfeeding, and someone really deflate completely after breastfeeding, those women will very rapidly reach a size 4 bra cup size, very rapidly. But it's edema; they haven't grown tissue yet.
So if they maintain that,
they have to maintain that to get the volume.
They'll reach a size D.
Yeah. Yes.
a D cup. If they can maintain the size
If they can maintain,
4, 5,
correct.
they can get to a D.
But in all fairness, I have seen very few women reach a D cup with just using Eve. I mean, I see a lot of C's, I've seen a lot of B's, but to reach a D.
If they already had a size C, they could reach a D.
If they already have a size D, they reach D, yes.
I have very firm tissue and I'm naturally very large and I want to go larger. I don't want a lifted look. I want a macromastia, very large breasted watermelon size. What are my options for going super, super big? Taking into consideration that I have a larger frame, I'm taller, it will not look out of proportion on me. I have a disproportionately small rib cage for my size. So I think it's really important to set expectations that this is not replacing an implant, right?
So, unfortunately, what's happened with movies, the news, etc., we have distorted our norms of beauty. People think that having that ball here is attractive. Maybe to a distorted view of natural beauty. If you look at the classic beauties, the classic sculpture, the classic paintings, the beauties before the days of the encapsulated implants, upper pole fullness does not exist unless it's an implant. Anybody who's got stand up naked and has balls sticking out here across the room like that, she has implants. This is natural breast growth. This is for natural breast. This is for the woman who want the natural look, not the implant look. If you want the implant look, have implants. This is for the smart woman who wants to look natural, does not want to have anything fake in her body. Does not want to have a fake look, want to have naturally larger breast. And a natural larger breast is not sticking up like this. If you want, Eve is not going to give you sticking up breast like this. This is an implant. This is not for the implant. This is not the implant look. This is the natural classical beauty looks. If you look at the classic paintings, the classic sculptures, the beauties of the 60s and 30s and before, not the recent ones which all have implants. The breast has a natural curve. It's pear-shaped. It's not a round melon. A mature woman beyond the age of 25 has a breast with a curve. There's a curve.
But a follow-up question is, upper pole fullness is really something that most of us want, even though of us who have a little bit of it tend to want more, because I think the question is, like, can it get it fuller on the top, not just on the bottom?
It'll get full everywhere.
It'll get full everywhere.
Correct. But the natural tendency of soft tissue is to hang like this.
Is to hang.
Okay.
It's gravity.
It's gravity. It's going to hang like this. It can't do this. Healthy tissue, unless there's something fake holding it like this, healthy tissue is going to hang like this, like a bag. Okay. If there's something hard holding it, it's an implant. And in my experience, a lot of the BRAVA women, the Eve women, are dedicated people who know that to get something good, you work at it. Nothing good is going to happen, really good is going to happen overnight like this. Yeah. So you really nurture it, you cultivate it, you work at it to get there. Okay, this is not like this. If you want this, get an implant. Get an implant. It's so much easier. If you want a false, get an implant. This is for the natural growth, purely natural. Nothing fake, nothing external, no hormones, no drugs, nothing. A natural way to enlarge. That's how we grow. That's how we grow as children. That's how everything grows in our body. You use a natural means of growing. But it takes time. Natural growth takes time. Can't beat it.
In your practice, have you noticed any cohorts of people who are good candidates versus not? Poor responders versus extreme responders?
Absolutely, absolutely. And there are two factors there involved. It's their biology and their adherence to the protocol. Okay, their compliance. Okay, biology, compliance. The biology is how tight the tissues are, the starting volume, the structure inside. A deflated breast from breastfeeding and pregnancy will stretch much easier. A white Northern European type of skin will stretch easier than an African or Asian that have tougher skin and tighter tissues. So the biology has to do with the starting volume, the laxity of the tissue, and their genetic composition, their genetic heritage. The compliance has to do with how good they are at keeping it. You know, I got a lot of women, doctor, I wore it every day. When we first launched BRAVA, we had little recording that told us how many hours a day they actually wore it. I wore it every day, I swear every day. We look at the recording. Ma'am, you missed Thursday. On Friday, you only wore it for 8 hours. On Saturday, you wore it for 7. Yeah, on Sunday, you wore it for 12. Ma'am, that's not the compliance. So it really has to be disciplined compliance. And we're not doing miracles here.
But what about age or body fat percentage, the natural skin elasticity, the starting, we touched a lot about this already, but starting size, tubers versus not, pre-pregnancy versus post-pregnancy, ethnicity and fitness level.
So again, ethnicity, we found that the Asians, the Africans, as compared to the white Northern Europeans, have tighter skin, is well known. Their dermis is thicker and is tighter and has harder tissues. So unless they've been pre-stretched or they already have significant volume, their initial growth is going to be a little slower.
So Asians and African descent.
They're still going to get there, but unless they've been pre-stretched by pregnancy, breastfeeding, or weight loss, it's going to be a little slower, especially if they're very small to start with. And these are the ones that takes a longer to build up. But these are the ones that would benefit the most from it eventually, because an implant would look fake and hard to put there, and this eventually would grow. But they have to be really disciplined, compliant, dedicated to get there. That's as far. We found no difference in age. We found no difference. Well, obviously, if you're fat, you're already big, so you tend to be bigger easier than if you're skinny and nothing else there. Yeah, if you have no fat at all.
Fitness level, somebody who's very muscular versus not.
Well, somebody who has very little body fat, what we're going to grow is fat here. So if they're in a constant catabolic state, they can't build up any fat. Can't do it, man. I mean, you're asking the body to deposit extra fat. So somehow you have to give the body that fat. If you are trying to lose weight, wearing it would be a good trick, because you lose it somewhere else, you won't lose it here, because here they say, I need to hold on to it. But if you really have nowhere, nothing, and you further, the body wants to deposit fat, and it's all about a balance of calories and fat deposition. And if you're in a situation where you're losing, there's nothing going to accumulate here. There's no miracle here again. This is science. There's we're not putting any fancy stuff here, fooling people. This is regular science.
And what about, some women have mentioned plateauing. They're continuing to wear it, but it hasn't grown anymore. Does that happen?
Very good point. Yes, while it looks like they have not grown anymore, but they've maintained the edema. The longer they maintain the edema, the more that edema turns into fat. So yes, they have stretched their tissue to the maximal stretching ability. Now they have breast full of edema. And if they keep on wearing it for a few months at that point, that part of that edema would turn into fat.
So here's another question that we see very common, is that once you reach size 4 and you're wearing it for 12 hours and your nipples touch the edge of the cup, so you take it off, right? Because you don't want the nipples to be touching the cup. And then the next day you wear it, and now at 10 hours you've reached the nipple. At what point do you stop wearing the cup? When it swells up and it fills it in an hour? Is that when you've reached the maximum use of that specific cup?
It's a good point. We recommend whenever the nipples touch the end of the dome to go to the next size. But I can understand the point where you want to stay, you don't want to, with wearing it less hours so that you don't reach there all the time, maintaining the edema, be effective. Yes, the answer is yes. Not as effective as if you moved to a size 5 and kept on wearing it for 12 hours. Now you're going to wear it for less hours, but you want to maintain the edema. If you can maintain the edema state for 6 months, you're going to grow some good tissue. Okay? But if you grow more, then you have more edema and more growth, obviously. But I can see the point where some people say, you know what, I filled them up completely. I've been wearing for 3-4 months. I've reached size 4. I was size 1 initially. Now I'm a size 4. I don't want to go to a 5. Let me wear it less hours a day, and I'll be willing to spend, instead of 6 months, 8 or 9 months. But I'll get there. Yes, you'll get there. There's no hard and fast rule. But the bottom line is you have to maintain a significant level of edema over a prolonged period of time to turn that into fat.
I think another question too is, so there's the edema versus the real tissue growth, and visually you don't know how much you've grown, right? So what should you expect if your edema, you're at that stage, size 4, you're filling it up every day. When you stop wearing it, what should the expectation be that you've...
Again, there's a tremendous amount of variation. Some women would reach size 4 very rapidly because they have deflated their breast after breastfeeding. Those women would deflate completely because they have done it. See, the amount of real tissue growth is a function of time more than anything else. You have to have worn it for at least preferably 6 months minimum to really get a significant amount of real tissue growth. But nothing can grow faster than that because as kids, in 4 months, you're not going to get that much breast growth.
What size? So right now it's edema. You take it off. And you've taken it off now for a month. But you've worn it for 6 months.
Good point. What you're saying is, how long of a time after you stop wearing it to say, okay, that deflation is gone, now I'm looking at permanent tissue growth?
Yes.
Very good point. It's not abrupt. It's not an abrupt curve. It's just it's a curve where you lose with time. But I would say 90% plus at 1 month is what you're going to get. You may not lose more than 10, 15, maybe 20% beyond 1 month.
You wear it for 6 months strictly every day, 12 hours a day. You've gone to size 4. You stop wearing it after the 6 months of rigorously wearing it 12 hours a day. In a month of stop wearing it, you can see the real results of what you've grown.
Pretty much. What you see is pretty much what you got. Yes. You could have grown to a size 4 in 2 weeks, in 3 weeks, or in 6 months. So it depends how long you kept that size 4. If you kept a size 4, if you start at size 1 and you kept a size 4 for 6 months, probably 50% of it is going to be edema. You probably go down to half the volume. There's no hard and fast. Everybody's different. All we can say is we've proven that you grow tissue. You know, when we give a treatment to treat cancer, not everybody gets cured. 50% gets, 40% improve. When we treat antibiotics, we give blood pressure pills. Not everybody gets another pill. So in medicine, everybody varies. There's no absolutely give this. I'm not changing the tires. I'm getting a better tire, or changing the spark plugs, or the size of the cylinder.
I think that's a very important point, that even if you're doing, let's say, an implant surgery, you're not going to be 100% sure how it's going to look when you come out. It's very hard to see until it's done.
Well, when you go to implant surgery, you want 200 cc, I stuff you with 300 cc.
Yes,
you
but
got 200
how that
cc.
would look?
Well,
you don't...
then there's a body reaction to it. It could cause a capsule, it can move, it can displace. Yes, there's a lot of uncontrollable body reaction, biological reaction. But you want 200 cc? Here's 200 cc. You want 300? Here's 300. This is not the same thing. The 200 and 300 cc are not going to happen because 3 months, I should have 200 cc.
Right.
You know, Everybody's different. All we can say for sure is that everybody grew, for sure. Everybody who complied has grown, for sure. It's effective. Some have grown more than others. Some have been more compliant than others. Some have grown significantly. The ones that were small have grown proportionate to them being small. The one who started large have grown proportionate to them being large. Everybody has grown. But there's no hard and fast rule. Oh, I've reached 90 days. That's it. Stop. 90 days.
So this is from someone who's actually used EVEBRA. Hi, Dr. Khouri. As someone who has already gained a cup from using the EVEBRA for 3 months last spring, I know that it works. I took a 3-month break after having a surgical procedure and am now on week 6 of my second round using EVEBRA. I wear it for 12 to 6 hours a day and intending to continue for 6 months this round. I'm extremely pleased with my current Cinderella swelling and I'm hoping I'm able to keep 2 cups this time. Other than adherence to the published protocols, are there additional complementary modalities you recommend? Massage, red light therapy, exomos, etc. Should there be an effort in slight surplus of healthy calories to put on 5 to 10 pounds during the retention process, or is keeping a stable weight okay? And lastly, I'm in my early 40s. I have always felt super self-conscious about my chest size, but have not wanted implants. Using the EVEBRA has been the first time in my life that I love my boobs. I super appreciate not only your invention, but in your enthusiasm and willingness to share your research and experience so openly. It is why I opt to purchase the product. Thank you.
Well, I have to thank this lady too. Thank you for her feedback. Yes, and that makes me feel good to know that we've done something to help women, give women an alternative to the silicone implant. Yes, this thing works, and obviously this young lady is determined, disciplined, and she'll get there. So the answer to her question is yes, I would expect her that she will continue to grow. There's no reason. If you start, once you gain that tissue, and things have settled, and now you have this new breast size. You're just like a new person starting with that breast size. You will grow again.
But her questions specifically are what extra things she can do. So the massage, red light, exomos, I don't know what that is.
Okay, all of these are hocus pocus. There's no science that massage or red light or anything will enlarge the breast size. There is evidence that taking supplements that contain hormonal-like products would enlarge the breast size, but this is not recommended because these hormones to the breast, estrogen hormones on the breast, are carcinogens. Okay, so you don't want to do that. So this is a natural way. The only thing I'll tell you not to do is to lose weight, because you're trying to gain fat here at a point where you're shedding it everywhere else. Obviously, gaining weight is a good idea because your breast will enlarge anyhow. You really don't want to gain weight, but try to be in a positive caloric balance so that whatever excess your body has will preferentially deposit in your breast.
And a follow-up to this. Recently, semaglutide, Ozempic have become very popular. Will taking these drugs affect the growth of EVEBRA?
Very good point. These drugs are really fantastic and they really work, and you can lose weight on these drugs, but they make you lose weight by curbing your appetite, your desire to eat, by prolonging your gastric emptying. You feel full all the time. So you eat less, you get less calories. Now, if you're getting less calories and you're shedding fat everywhere, you're probably going to shed it there. If you wear EVE during that period of time, consciously, your body is going to say, no, don't shed it from here, shed it from everywhere else. So you may be able to retain your breast size while losing weight, while doing that. That may be a good thing to do. But if you're going to lose weight, anybody will lose weight, the breast gets smaller because nothing about it. Breast mostly fat, so you lose the fat, you get smaller. But if you wear EVE during that period of time, The body said, no, don't lose it here. You can lose it everywhere, but I need to keep it here.
This is an interesting one. Is it possible to create a suction device for buttock enlargement as well? Or would the buttock region require different mechanics to create growth?
I don't see a bra for the buttocks. You sit on your butt most of the time and run around your buttocks. So trying to put something around your buttocks with an extremity that moves around is not practical. So no, it was not designed for the buttocks. And I know some people who've tried it, slept with it on their buttocks, and yeah, it will give you a larger edema butt-like. You probably could have a Cinderella effect on your butt. If you lay on your stomach and wear it for 12 hours and then go out, you'll have a Cinderella butt effect.
Is there any harm? Could it cause any?
No. As long as you adhere to the proper pressures. If you pump it too high, use a hand bulb or some of those machines out there, you can cause damage. Pressure is very important. High pressure destroy capillaries, bust blood vessels, compress the tissues, prevent blood supply. No blood supply, tissues die. You get necrosis. You get all kinds of terrible things. So yes, you have to have a controlled, gentle, low pressure.
So you invented BRAVA, and there's a lot of questions of why is BRAVA not available anymore?
So when I introduced BRAVA, there's a company there that started around it, and it was really a nice company, and we were building and selling BRAVAs. We realized that real tissue growth was very slow, but we immediately saw that, man, we created a tremendous recipient side that now fat grafting may work. So BRAVA starting to be sold for fat grafting, and that was in the early 2000s. When BRAVA, the company, went to the FDA, say, here's a device that's out there for enlarging the breast. We want to change the indication of use for preparing the breast for fat grafting. The FDA said, there is no predicate device. You're not compared. This is something totally new. This means it's a class 3 device, means you have to do really very serious, long-term, multi-center, prospective, randomized studies with a large number of subjects with long-term follow-up to get this approved. A process that at the time, BRAVA, the company, calculated was going to cost tens of millions of dollars. It was a small company, and it was a company decision at that point to say, thank you, we close. We're not going to do this. The FDA was very serious. Say, don't sell it to the public for fat grafting. You can sell it to just enlarge the breast, but don't sell it for fat grafting. They thought it was not worth it. They saw this picture as preparation of fat grafting being much bigger than just simply enlarging the breast. So the BRAVA, the company, closed its doors. Being convinced that it really helps patients, and being a surgeon and a doctor who takes care of patients, faced with patients every day, I knew there was really a need for it. So I revived it under the name Eve. I've improved it. It's no longer an adhesive that's irritant, but a lubricant that glides and has taken care of the shear forces, much easier to wear, multiple sizes, so we improved the technology, and now it's available to enlarge the breast. We call it EVEBRA because BRAVA at the time was another device. And we still, in the United States, don't sell it for fat grafting.
Dr. Khouri, this one's a very important one, and we get asked this a lot. Why is the system so expensive?
Very good question. I wish I could make it cheaper. The problem here is that this is a device that is built to medical standards. We're using medical grade materials. The companies that manufacture it are companies who manufacture medical devices, not consumer devices, different standards altogether. This device has tremendous amount of engineering behind it and science behind it. This device has actually very expensive medical grade silicone in there. This device has a long history, and really it is medical grade material, medical grade engineering, medical grade manufacturing, medical grade authorization, all kinds of things here that really differentiated from the consumer devices that are cheaply manufactured in East Asia. Our device is currently manufactured in the US. US grade, US technology, US factories. Another important issue that distinguishes it from the other novelty devices is that that little pump there has electronic controls that are designed, engineered, manufactured to a very rigorous standard to maintain a pressure that is safe. And it took a lot of work to get to what is a safe pressure. And so pumping it, whatever, is dangerous, ineffective, and can be a big problem. We have put on the market a device that we have proven to be safe, proven to be effective, and is built to medical standards, and is different from the consumer items. I do orthopedic surgery. The little screw we put for the wrist costs $1,000.
It's a little screw.
The little screw put in a wrist fracture will cost $1,000.
For you to buy?
No, that's how much insurance, that's how much Medicare, that's how much, that's how much that screw costs. The Johnson & Johnson, the manufacturer of that screw, sells it to the hospital, to the clinic,
exactly,
to the patient for $1,000. One screw, okay? One screw. Medical grade medical device, all right? You can get that same screw at the hardware store for a couple of bucks, not even.
But it's not medical grade. Okay, here's another question. Are there any pumping signs, redness or swelling, that would demonstrate successful pumping and that would eventually mean successful breast tissue growth? In other words, does sustained swelling post-pumping correlate with successful breast tissue growth? Good point.
Somebody comes to me and say, I've been wearing it all the time and I just took it off and I look at it and there's no swelling. There's no swelling. They didn't have the vacuum. They thought they had it on, but the vacuum was not there. So yes, when you take it off, you need to see substantial swelling. If you just put it for a few hours, you should be able to see some swelling, some redness. A small amount, not purple red, but a small amount of redness is normal, is expected. If you don't see it, you didn't have the pressure. If you don't see swelling when you take it off, you didn't have the pressure. It wasn't working. You need to see some swelling. Yes. Unless there's swelling, no swelling, no working.
Makes sense. This question comes up a lot. Does EVEBRA fit every body type? Is it a one-size-fits all for all chests?
It's a very good question. And the answer is obviously no. Okay. So we designed it, we spent a lot of time, effort, prototyping, testing to get one size that fits most. But it really, people on the extremes are not going to fit in there, okay? And the extreme we find the most frustrating are the most petite ones, where they just can't get to see it because it's where it goes too far back. So if you take a measuring tape and your chest circumference right under the breast, around the breast with that knife is 30 or less inches, you're probably going to have a hard time for it. We are currently in the process of making a special size for the extra small, hopefully be available pretty soon, the extra small size for those ladies who are, if I take my hand together, I can wrap around their chest. Those women need a small size. This won't work. Now, on the other side of the spectrum, there's a 42 chest circumference already there. She will probably also need a larger size. We don't have that right now. And she can wear it, she'll get a seal, but it'll be really growing only the central part of her breast, which is not a bad idea because they'll be more, more pointy, if anything. But the one that struggled the most are the smallest one who really would love to have it because they're really typically small and they have a hard time getting it, and an implant is a problem for them. And for these women that are less than 30 circumference, I think hopefully pretty soon we'll have the extra small size. Frequently asked question, is there anything we could do to accelerate the process, the natural process of tension-induced tissue growth? We think there might be. Nothing fancy, but where there might be, and we may be starting a clinical study to prove this or investigate this. And we're actually looking for potential volunteers. So if you are, let us know. Here's what it's all about. There is a product out there on the market that if you inject will induce fat growth. Typically it's used as fillers for the face. Instead of using a filler, you will inject it and it will cause a little fat to grow instead of putting a artificial filler. The product name is Renuva. It is on the market, that is known to induce fat growth if injected in fatty sites. There's experimental evidence that combining this product with tension-induced tissue growth is more than additive. That is 2 + 2 equals not 4, but 5 or 6. We are looking forward to a clinical study that could combine these two and then significantly accelerate the process. So we would be injecting that product in the plane, in the area around the breast, not in the breast, but the fat that's around the breast, and use the EVEBRA and show, hopefully prove that it's better than EVEBRA alone, it's better than injection alone, that the combination really accelerates the process. We're in a process of recruiting. If you're interested, please contact us. My mission as a doctor, as a physician, is to help people. And we're providing them here with something that I believe is natural and is better than a faulty implant. I'm not wearing a wig. I'm accepting myself, not hair. Well, I mean, I had my period where I said, I wish I had, but I'm 60, I'm gonna live with that. Same thing here. Breasts are so important for our society, and I'm giving the women the alternative to surgery, to falsy, to a foreign body inside them. So if you are successful using EVEBRA, you would be doing women a favor by letting you know that, so that more women will follow you and will get it as compared to the alternatives. We would love to build up a cohort, a gallery, a follower. You don't have to, of women who say, I've used it for 6 months and I've grown a cup or 2 cup size. It's a fantastic, it's changed my life. I feel more confident and everything like that. That kind of things would help us help more women.
Another very frequently asked question is, I am a man transitioning to become a woman. Can I use this device as well as a male body, as a male-born body?
Absolutely, absolutely. I must admit that early in our experience, some 30 years ago, some of our best results were with the transitioning. And back in the days, it was not an acceptable thing to do. But I was impressed because these patients, these transitioning individuals were actually very compliant. They really wanted to get breasts, so they were really sticking with the protocol. Those days, doing surgery, having an implant was not covered by insurance if you're transitioning, so they had no choice. And we had some impressive results. Bottom line is, it's a natural phenomenon. You stretch tissue, it grows. Whether you put it on your breast, your thigh, or whatever. Here, it's easy to put as part of a bra. On the buttocks, it's going to be more harder to apply. You're not going to put it on your head to get a cone head or anything like that. But if you pull tissue over time, it's a natural phenomenon, natural response of healthy biologic tissue. Tension induces tissue growth. Well established. So yes, it will work on a male that wants to get breast. And yes, it's actually a very good alternative for these individuals who really would love to have breasts and be natural and not look like they've stuffed themselves with an implant. I feel for these people. They should get it.
And a follow-up to this question is, is it safe to use it while on HRT, the hormone replacement therapy medicine?
It's two different mechanisms. There's no effect one over the others. They're two independent mechanisms. One is hormonal induced tissue growth that is a hormonal sensitive organ. And the other one is mechanical growth of anything. We can lengthen bone, we can lengthen nerves, we can lengthen everything, but just tension on it. So two separate mechanisms, and they work separately. And yes, you can use one, use the other. Now, hormonal therapy has side effects. This one has minimal side effects of irritation and the nuisance of having to wear it every day.
But yes, you can combine the two.
That's no reason why not. But each, there's two separate pieces, two separate things, no problem.
Okay, here's another question. Hello, doctor. Is there any risk of getting a blood clot or any circulatory issues while using it? I really want to use it, but I'm worried.
Okay, the device has been scientifically studied at the pressure of the small pump that comes with it. There's no danger of blood clots or circulatory issues. If you start using a hand pump or any other pump, you may get in trouble. But this has been proven to be safe at the low pressures that the small box that comes with it applies. Small, low pressure are safe. Higher pressure can be dangerous. If you use it as directed, we've seen no evidence of any blood clot or circulation problem or anything like that. But don't play around and start using. I've heard someone sucking on the tubing. You can generate tremendously high pressure sucking on the tubing. Don't do that. You can use a hand bulb. Don't do that. You can buy some pumps on the market to use for wound care. Don't do that. This is against our recommendation. Only use the pump that comes with it. It's been medically, scientifically proven, designed to be safe.
Pumping methods, from your experience, is there much difference between pump and hold or pump and release? How hard am I supposed to pump till it hurts? Is purple too far? Now, this question is non-EVEBRA specific. This is about pumping breasts. So,
yeah, absolutely. And I have to really go back to the science, the safety of the EVEBRA device. Specifically, it comes with its own calibrated mechanical pump that has a sensor that maintains a safe pressure. You play around with pump and hold and you get in trouble. You may be lucky not get in trouble, but there's a chance you get in trouble. Don't use the EVEBRA with anything else than the small pump that comes with it. I know there's a tendency and it's tempting to pump it higher and to swell it tremendously, but these are not safe movements. Okay? Do not go beyond the pressure that's been proven to be safe and effective. I can't tell you more than that. Do not play around with these things. Don't play with your health. This is dangerous. This is a medical device that's been scientifically proven to be safe at this pressure. Reviewed by the FDA, who told us it's safe, okay at this pressure. We go beyond this pressure, you're on your own. We're not responsible. You may get in trouble.
In trouble as in you might get hurt.
You may have dead tissue inside your breast. You may have hematomas. You may have blood clots. You may have all kinds of horrible things. Don't do it.
And follow up to this, if you continue with protocol, can you lose sensation?
It's actually the opposite. It's really very interesting. The stretch of Eve stimulates also nerve growth. And it's our experience that the nipples become very sensitive. Temporarily, it comes down to normal. But when we do this, and I do this in my practice as a surgeon, separate from BRAVA, when I do this for breast reconstruction on mastectomy patients.
One more question. Can you overpump with EVEBRA?
If you use the pump that comes with the EVEBRA device, you cannot overpump. That pump will not go above 20 milliliters of mercury. Even if you squeeze it, it'll leak back to 20 milliliters of mercury. If you play around, do other things, you can get in trouble. If you use, as described, as recommended, the pump that comes with the EVEBRA, you will not be overpumping.